The following program contains mature subject matter. Viewer discretion is advised.
He made history as the first pregnant man, giving birth to 3 beautiful children.
You know, I love my babies.
Now, Thomas Beatie has decided to take another step.
It was my choice to have my outside match how I feel on the inside.
And the doctors are with him as he undergoes genital reassignment surgery.
Skin was transplanted from one part of my body to that part of my body.
How this works surgically is what's fascinating everybody right now.
The scare.
I think the tissue didn't take.
The surgery.
I would definitely do this over and over again.
The scandal.
Obviously, Nancy's not here with you today.
The pregnant man's surgery. All new on The Doctors.
Doctor, give me the news.
Welcome to The Doctors. It's the shocking medical story that's made headlines around the world. Thomas Beatie, the pregnant man, became the first legal male to give birth. Not once, but 3 times. But now there's a shocking update to his story that we're about to share with you in a world exclusive. But before we get to that, here's a look back at how this man gave birth.
Tonight, the bizarre story of an Oregon man who says he is pregnant.
A transgendered man who was born a woman says he's pregnant.
Just so everyone at home understands this, Thomas is legally a man, married legally to a woman, but you still have female reproductive organs.
I do, and I chose to keep them because I didn't feel that removing them would make me any more or less of a man. It would just make me sterile. Being pregnant wasn't an easy decision because I had worked so hard to transition to male, and I realized that in going through the process of pregnancy might erase some of the progress I made with my body.
Why do you think it's so difficult for people?
Just the concept of transitioning is hard for a lot of people to understand. People who are born in one body and they feel different inside their minds and their hearts. When I started dating Nancy, she allowed me to fulfill my inner desires and go through the transition. My breasts were the first thing to go. I've had hormone replacement therapy. It causes secondary sex characteristics to form. I have hairy legs, my voice is deepened. What most people don't know is that after I gave birth to Susan, we went on to have 2 more sons.
Thomas and Nancy, introduce us to the family.
Here they are. This is Austin, 2 years old, Jensen, and Susan. People just need to broaden their horizons and look more introspectively. This is a very healthy environment for us to raise our children because they have a loving mother and a loving father and loving siblings.
After a show, Thomas decided to undergo more surgery and have a true sex change. Now, he already had his breasts surgically removed, but he still had female genitalia. So he elected to undergo bottom surgery to transform his vagina into a penis. Now, Thomas will be out here in just a moment to tell us firsthand how it went. But first, I want you to meet his surgeon.
I'm an OBGYN by training, and over the years I developed a very unusual subspecialty, which is transgender surgery. In the US, there are very few people that perform transgender surgery. We're a pretty small club, so we all know each other. About 15 years ago, I went through transition myself. I met Dr. Biber, who was kind of the grandfather of transgender surgery. Having gone through transition and then realizing that there were just very few surgeons coming up, I moved my practice and learned from him and took over from there. We've raised the bar as far as the quality and the expectations for surgeries and given people some new hope and some new optimism in this area of medicine. You can imagine walking out tomorrow and being a woman or being a man. Whatever state of dress you're in, your body matches the feelings that you've had your whole life.
Please welcome OBGYN and gender reassignment surgeon, Dr. Marcy Bowers, to the show. Welcome to the show. So you've been through quite an amazing transformation yourself.
Oh, yes. In the mid-1990s, I went through transition myself.
And transgender surgery isn't something that gynecologists usually perform, but do you think that your personal history has made you connect more with your patients and want to pursue this specialty, this special course?
Yes, no question, Lisa. It's, I understand the importance that surgery takes on for the individual.
Having done it yourself, I'm sure really puts your patients at ease and helps all the way.
I think it helps, and you know, I mean, the things we do as obstetricians, I deliver babies, and handing someone a baby is a life-changing event, but handing them a new genitalia is miraculous.
Yes, for sure.
Had you heard about Thomas's story before you met him?
Well, Thomas actually contacted me when he was about 20 weeks pregnant and asked what I thought of first of his situation and then what he should do to educate people. And so I was very supportive. I believe his story is about reproductive rights. And, you know, and this is, you know, procreation is a human right. And so Thomas just did it in an unconventional way.
Well, obviously, a sex change operation, it can spark a world of questions for any patient. Is it going to hurt? Will I be out of commission? More importantly, will it work? Well, these were all questions Thomas had to consider during his pre-surgery consult with Dr. Bowers.
We're on our way to see Dr. Mercy Bowers.
Thomas has a number of difficult choices to make today. It's either that we're going to build a urethra as part of the penis or we're not. Just lay back that way. My hands are cold here. So yeah, you've got a lot of growth. The simple metoidioplasty simply releases the testosterone enlarged penis from the labia minora. The ring meta is more complicated, and that is constructing a urethra. See, we cut here, but we're going to sew it underneath. So we're going to make a tube out of this. Now, adding the urethra has the most complications. There's additional problems like strictures or narrowing of the urethral flow, or breakdown of the stitches, or little pinpoint holes where the penis leaks urine out.
So how fixable is that?
Anything's fixable. But it may take, it could take 1 or 2 even revisions.
Yeah. So I guess to pee standing up or not to pee standing up?
To pee or not to pee?
That's the question, yes. Well, I'm feeling better about the ring metoidioplasty now.
So are you thinking the ring meta then?
I'm thinking the ring meta.
Coming up, our cameras give you exclusive access into the operating room as Thomas undergoes gender reassignment surgery. Did it work? Is he happy with his decision? Well, Thomas is here and breaking his silence for the first time to answer those questions and more right after this.
Coming up.
This is what I've wanted for a very large part of my life, and I'm actually doing it. Words can't describe what I'm going through right now.
We're creating the ring, and this is going to be our first flap.
And later.
I'm starting to freak out right now because I'm afraid that transplanted skin tissue didn't make it. I think the tissue's dead down there. I think it didn't take. I think the tissue didn't take.
The following program contains mature subject matter not suitable for young viewers and images of an actual surgical procedure that may be graphic and disturbing. Viewer discretion is advised.
Not many people understand the transgender person and what we go through and how we live and the decisions that we make. And with science, we're able to fully live our lives and live in bodies that we never thought imaginable.
Thomas Beatie made medical history by becoming the first man to give birth a total of 3 times. And now the pregnant man is making headlines again by undergoing gender reassignment surgery to transform his vagina into a penis. And in a world exclusive, Thomas allowed our cameras to follow him into the operating room. I do want to give you all a warning. What you're about to see is graphic. It's not suitable for small children.
Right now, this is the moment of no return. I've made my decision and I'm going in. This is what I've wanted for a very large part of my life, and I'm actually doing it. Words can't describe what I'm going through right now.
Hey! Good morning. How are you?
Good.
Thomas is about to have his ring metoidioplasty, and I think this is the future of surgery for these guys. Uses their natural tissue We're not reinventing the wheel. All this stuff is sensory, it's local. I think it's the best available option at this point. Looking forward to it for him. We're creating the ring, and this is going to be our first flap, the so-called ring flap. This is exactly the same tissue that becomes the urethra in the biological male, so it makes total sense. Now we're going to move on to do the vaginal flap, and that'll line the ventral portion of the urethra. Now this is really tedious because, of course, where we're dissecting is going to be right below the bladder. If you go too deeply, of course, you could injure the bladder. So now we're going to put a Foley catheter in, both to protect the urethra and also to give us a stint so that we can sew the new urethra around. Getting reasonably close to really starting to finish here. The head of the penis looks great, and we're coming around. Definitely projects forward. It's really great, I think. We're about all finished. Like that went well. We were able to get good mobility on the penis itself, and yeah, we'll see how he does.
That was a little over 2 months ago. Thomas is here now, and a doctor's first, opening up about his decision to undergo sex change surgery. Please welcome back to the show, Thomas Beatie. Thomas, thanks. Thanks for being here. So we're going to get into some of the details of the operation in a minute, but just overall, how are you doing now?
I'm doing well. I feel really good. I feel excited about the future. And doing this procedure for me was an elective decision. It was something to enhance myself so that I could pee standing up and also have more enjoyable, fulfilling sex.
We understand that you were a female wanting to be a male, and how this works surgically is what's fascinating everybody right now. So if you could explain that, what you did, it would be great.
Well, Dr. Masterson, I actually have an onion here, so we're going to create a penis out of an onion, which will be another first.
That's a trick.
So if I can, I'm just going to demonstrate, but what the pink pin is the clitoris, and the green pin is the urethra, if you will. And what happens is on testosterone, the clitoris elongates, and it pulls the lip skin with it. The trick is, in the surgery, is to create a urethral tube beneath that and then close around it. So what we do is we create a flap out of the skin between the lips to line the back portion like this little piece of onion, and then we take another flap from the front of the vagina and we mobilize that, and it creates the other portion of the urethral tube, the P tube. And then the labial skin is brought around that, and there's your penis. There are other techniques, but this particular one is good because it uses all local tissue. It doesn't need any skin grafts, and it has sensation like the original tissue. So he can get erections, he can have orgasms, and he should be able to pee through
Standing up.
the tube, standing up.
And that's very important for us guys, right?
Yeah, I couldn't wait to join the club.
And just so everyone understands, you know, it is complicated. When we're talking about female genitalia versus female reproductive organs, you still have all the reproductive organs that do produce estrogen, female hormones, and now by supplementing with testosterone, that's how Thomas is able to increase the size of his clitoris, do the flap surgery, so that now it has the appearance, presumably, we're not going to obviously show pictures. We're not. But presumably gives it more of the appearance and the feel of a penis. Well, don't go away. Thomas is answering the million-dollar question. Has he had sex yet? Is it different? Is it better? Plus, he's opening up about some side effects that left him very worried just day after the surgery.
I'm starting to freak out right now because I'm afraid that transplanted skin tissue didn't make it. I think the tissue's dead down there. I think it didn't take. I think the tissue didn't take.
The following program contains mature subject matter not suitable for young viewers and images of an actual surgical procedure that may be graphic and disturbing. Viewer discretion is advised.
The pregnant man, Thomas Beatie, is back today with a shocking update in a doctor's exclusive. He just underwent gender reassignment or bottom surgery to obtain male genitalia. But in the days following his surgery, Thomas became concerned after noticing some side effects he didn't expect.
All right, so today's Monday. It's been 4 days since my surgery. The coloring is coming back except for one area. And that area is the underside where skin was transplanted. It's pretty much black. So I'm starting to freak out right now because I'm afraid that transplanted skin tissue didn't make it. I think the tissue is dead down there. It doesn't look right. It's black and it doesn't feel like a part of my body. I knew this was going to be a complicated procedure. I knew the risks were higher. Just was crossing my fingers that everything would be okay.
To address his fears, Thomas underwent a post-op follow-up with Dr. Bowers.
So Thomas, tell me what's going on.
Well, pretty certain that the skin graft failed because I'm not able to stand and pee.
Let's take a look. Okay, I see the breakdown you're talking about, and it's not very big.
Have all the stitches come out?
They've all either come out or dissolved.
It's still pretty sensitive down there, and it still bleeds a little bit.
There was a lot of extra skin. It's always better to leave skin than it is to take it and then knead it.
So what do you think, Dr. Bowers? What does all this mean?
Well, let me think about what I've seen here, and I'll come up with a plan.
Well, so what's the next step for Thomas?
Well, Thomas has that dark area that we talked about was a skin flap from the labial skin that was meant to cover that area. That did break down. So there's about 1 centimeter that has opened, and that's made it difficult, I think, for you to pee.
Yes, now I do sit down because I would make a mess if I stood up.
Okay. So that is actually a relatively straightforward
So really
closure.
more of a breakdown, a separation than a problem with loss of the flap. And the good thing in that area, the blood supply is so good and things heal so well. And a little leakage early on is not that uncommon and something that should be able to be easily addressed.
That's right. What you do is you just trim the skin back to healthy tissue and then close it in 3 layers with a catheter inside, let it heal, and it should be okay.
And you know, you knew going into this that side effects were possible. So all things considered, sitting here right now, are you happy with your decision?
I'm totally happy. I would definitely do this over and over again. Even the outcome that it's had right now, I know that things are going to eventually be where I'd like them to be.
And one thing that we do want to address is obviously Nancy's not here with you today.
Yeah, she's not here. She hasn't seen my new me yet. We, like all marriages, we have our ups and downs, and we're going through a rough patch right now. And at the moment, thank you, we're separated.
Well, we're all very, very sorry to hear that. And Dr. Bowers, I know that Thomas has another procedure coming up to correct the problem we just discussed, but presumably with that correction, he will be able to stand up like he said he wanted to and urinate and have sex and do all the things that he...
Yes, I think he'll be standing proudly.
Thomas, best of luck to you. Thanks so much for sharing your story. Thank you, Dr. Bowers, for being here. We really appreciate it. And coming up, the